So why I chose my project. In the future, my future career path is going to be in medicine of some sort, and as a definite path, I want surgery is like a must, I feel. I'm not sure what specialized field, but definitely surgery. And as a healthcare provider, I will need to know how healthcare works domestically as well as in foreign countries, so I know how I'm actually doing my job correctly. And my thesis, before I started the project, was from my inside perspective of healthcare, I believe the United States will continue the most efficient and effective iteration of healthcare. So, next. So,
Keep
yeah,
going.
next. Yeah. Thank you. Okay. So there's four basic arrangements of healthcare globally. The first is the Bismarck model, which is where both healthcare providers and payers are private entities. They use private health insurance plans, usually financed jointly by employers and employees through payroll deduction. And then the Beveridge model is healthcare that is provided and financed by the government through tax payments. So there are no medical bills, as medical care is seen as a public service, like the fire department or a public library. The National Health Insurance model, it takes elements from both the Bismarck and Beveridge model. Healthcare providers are private, but the payer is a government-run insurance system, and citizens all contribute monthly. This system makes it so government pays for medical bills, and also there's no need for marketing and there's no profit, no expensive medical underwriting. This makes it much more affordable and inexpensive than private health insurance. And finally, the out-of-pocket model. This applies to most countries in the world. This model is for nations that are poor, unorganized, underdeveloped. They don't have the resources to sustain a national or universal health care. In these countries, the rich get the medical care, and the poor can stay sick or even die because they don't have the money. They have to pay out of pocket for their medical treatment. So next. To measure a healthcare system's quality, you can use these four components. So first is coverage, which measures how many people can receive healthcare regardless of age or wealth. Quality refers to how satisfied the patients feel after a treatment. And on a more global level, quality describes the overall national health and longevity of a country. The cost, a successful healthcare system will always depend on affordable cost and how much coverage will be included with how much you pay for that healthcare. And finally, choice. Patients want the freedom to be able to pick and choose what doctors, hospitals, and treatments they can receive. And the patient should be able to choose the doctor and hospital suitable for them, not the insurance company. So just a few examples of healthcare systems, the top performers using that significant model, or specific model, sorry. The Bismarck model is used in Germany. They have sufficient coverage, quality, and choice, but there's some lacking elements in cost. Next would be Great Britain. They use the Beveridge model. They have good coverage, quality, and cost, but their choices are quite limited with there. And then Canada uses the National Health Insurance model. Like the Bismarck model, they have the same coverage, quality, and choice, but their cost is quite detrimental. And finally, the out-of-pocket model in Cambodia. As you can see, the third world countries don't have the resources and simply cannot have any of the luxuries of modern healthcare. So now the United States, you may be asking, what does the United States use? That's my whole thing for this project. So if you go to the next slide. Yeah. So for most working people under 65, we're Germany. Employees and employers each contribute to healthcare premiums for their coverage. And using private health insurance, workers and employers using payroll deduction or co-payment, while the insurance receives most of the payment, with some going to the federal government. So that's for most people in the US today. For Native Americans, military personnel, and veterans, we're Britain. Some United States organizations that employ this model are the Veterans Affairs, the Pentagon's TriStar system, and the Indian Health Service. For these individuals, healthcare is paid by the government and with government-owned hospitals and doctors. Patients will never receive a medical bill, and healthcare is a public service.
Sorry, bud.
That's all right. For those over 65, we're Canada. So for this model, this is the U.S. Medicare, where low administrative costs and comprehensive participation of the government plays a major factor. And finally, for the 45 million uninsured Americans, we're Cambodia. People in this category have to pay for their medical bills out of pocket at the time of treatment, unless they're sick enough to be admitted to an emergency room or a charity hospital. And yet, we're like no other country. America has a convoluted and confusing conglomeration of healthcare, making it hard to pinpoint, ascertain the weaknesses of our arrangement. In contrast, most developed countries have decided on a universal system of fair, simple, and affordable healthcare for everyone in their nation. So next, we'll go to our flaws in healthcare. So in terms of coverage, 15% of the American population, which is over 45 million, don't have access to healthcare. The wealthiest nation in the world spends 17% of its healthcare costs through out-of-pocket payment. Also, most medical insurance has so little coverage that it can't help with serious medical bills, leaving patients in financial trouble, and can even cause them to be bankrupt. Cost, the United States is the world's biggest spender on healthcare. Our country spends 15.3% of our GDP on healthcare and roughly $7,000 per person. America is the only developed country that relies on for-profit insurance companies to pay for healthcare. All other developed countries use non-profit universal healthcare systems for better coverage. Quality, for the amount of money we pay for healthcare, our statistics are quite embarrassing. The avoidable mortality benchmark shows how well a country can cure a disease that is curable. Out of 19 developed wealthy countries, the U.S. ranks the worst. Wow. Perhaps most disturbing, though, is the fact that America has the highest infant mortality out of 23 developed countries, with 6.8 deaths per 1,000 births. And finally, for choice, most American health insurance plans have a provider network that is attached to your health insurance, which is a list of contracted doctors and hospitals that are allowed. This means that you're limited to a certain list of doctors that might not have the best treatment for you, for your certain illness or injury. So next, finally, obviously, healthcare reform is required in the United States, but is it even on the agenda? Well, the problem is the multi-billion-dollar insurance companies have a large claim in American healthcare. If our country was to completely revamp and create a universal healthcare system, the flow of income would take a heavy hit and lose their place in the economy. Healthcare in America is not seen as a basic human right, but rather a business, with profit and personal gain trumping all else. So, that's it.